Next question comes from Krista, who says, I agree with you that Obamacare has been a disaster. What is your take on what is your take on what it's going to be replaced with? Well, first of all, as you mentioned, Obamacare, the Affordable Care Act, is collapsing. Those aren't just my words. Heck, my neighbor, Mark Dayton, the governor of Minnesota, a Democrat, late last year said the Affordable Care Act is no longer affordable. He said that because in Minnesota, premiums were going up, in some cases by as much as 67%. Heck, last year, I think it was in October, President Bill Clinton said it's the craziest thing when talking about Obamacare, talking about how some people have to work so hard and see their premiums go up while the system isn't working for them. And so this is a system that is collapsing. It is failing. It cannot be fixed. We need to put something completely new in going forward. So I applaud people in the House and the Senate for saying we've got to repeal Obamacare and we've got to put something better in place. In fact, this last week when the statistics came out about the proposed legislation, the Congressional Budget Office actually pointed out that if nothing happens, if absolutely nothing happens, 28 million Americans will lose access to health insurance coverage over the next decade. That's just completely unacceptable. And so I applaud people like Paul Ryan and others for trying to find a better way to take that going forward. And so they put a plan out. I've been talking to them and people in the United States Senate and in the White House to say, that's great, you got to repeal it, but now here's some things you need to work on. I applaud Paul Ryan and others for listening to many of the concerns I and other governors have raised along the way. I appreciate the fact not only are they addressing that funding that I mentioned that helps people in long-term care facilities, either those who are seniors who may need specific long-term care or people with very severe disabilities who need that additional assistance. But on top of that, some of the changes I mentioned in terms of making sure that when they replace the system that put in place under Obamacare, where they had subsidies for people who are not covered under Medicaid that could purchase health insurance plans on the marketplace, that these credits, which would be a shift, go from government mandate and requirement to market-driven, getting the government out of the way, have the market drive it, but put in place refundable tax credits that would help people be able to purchase health care for themselves. I appreciate the fact that they've listened to some of our concerns, and one of the specific things that have been introduced in the last, I believe, 24 hours or so was this idea that maybe this push that you got to increase the amount of the tax credit, the refundable tax credit, for people in their 50s and 60s all the way up to Medicare eligibility, because there's much, much higher cost. And to be able to afford a plan that provide even basic coverage would cost more than they think they originally accounted for. And so they've done that. They've acknowledged that. I think that's a giant step forward. I think overall it's just really important to remember that anytime you're talking about health care, people understandably get very, very concerned. I have compassion for those who are looking at this, trying to figure out what exactly does all this mean. Truth be told, the good news is for most of you tuning in, and most of us aren't affected. Most people in Wisconsin and across this country get our health insurance from our employer. This doesn't directly affect us, any of the changes, both under the Affordable Care Act and under the repeal and replacement of that. That doesn't fundamentally change what we do under employer-based plans. And for seniors who might be tuning in, who get their coverage under Medicare, again, this doesn't directly affect them. What this covers is a small sliver of people who don't have access to employer-based plans. Maybe it's someone who started up their own business. Maybe it's someone who works at a small business or doesn't have access or only works part-time. And so we need to get this right to help make sure those individuals have access to affordable health insurance coverage plans out there. Providing a credit's a reasonable thing. Some have said, well, why would you provide a credit? Well, the reality is the tax code already benefits those of us in America who receive our health insurance from our employer. So why wouldn't we level the playing field and allow the same thing to be true of those who need to purchase their health insurance on their own? And that's really all that this does going forward. So those are really, really important things. And I get why people are concerned. I have compassion and concern to make sure we account for the issues that people are raising. But I think with the changes they're making in the House of Representatives, it's a positive direction. I think there'll probably be some additional changes in the United States Senate. The one thing that's certain is Obamacare is not sustainable. It is collapsing. If we do nothing in America, people will lose access to coverage. It will just be an awful situation. We've got to fix that. And so I applaud those going forward.